Today we will be demonstrating enema administration.
I would perform hand hygiene and provide privacy. Hello, Mr. Waters. I'm Melinda. I'm going to be your nurse today. Can you tell me your date of birth and name? Okay, 9/17/93. I was looking at your chart and I saw an order for 1,000 ml soap suds enema. So I'm going to be administering that for you. When was your last bowel movement? Okay, and I'm going to check your abdomen. Okay. I'm going to check his abdomen for any distension. It's a little distended. For the enema, I'm going to have you lay on your left side, and when I insert the enema, you might get crampy. That is normal. If you're feeling any pain, tell me. Have you had any rectal or prostate surgeries recently? No? Okay. So I would take the enema, put the soap in the top of the bag, and gently roll it to make sure it's all mixed up. And I would make sure that the enema was 100 to 105 degrees Fahrenheit. Then I would prime the tubing. And open my lubricant. Lubricate the tip 4 to 5 inches. Okay, Mr. Waters, I'm going to have you lay on your left side for me. Are you able to get up and go to the bathroom? Okay, so I would make sure that he had a clear pathway to the bathroom and slippers at the bedside. If he could not get up, I would put a bedpan in the room for him. I'm going to examine his rectum for any fissures or any hemorrhoids. If he had those, then we wouldn't be able to give the enema and we'd have to call the doctor. So I've lubricated the end of the enema. I'm going to insert the enema now. Okay. If I want it to go in a little bit faster, I would raise the bag. If I want it to go slower, I would lower the bag. Okay, Mr. Waters, I want you to hold that solution in as long as you can. You want them to try and hold it in for 5 to 15 minutes, if possible. I would throw this away. I would put his bed down, give him his call light. When you need to go to the bathroom, make sure you call me. You have to go, okay? So I'd help him up to the bathroom. When he goes, I would look at the stool for consistency and color so I could document. And then I would check his abdomen for any distension. I'll lower his bed and give him his call light. Another kind of enema that you can give is a Fleet's enema. This is already lubricated. So for this, you would just take the cap off, squeeze out the water, and when you insert it, you squeeze out the air, so you're not inserting any air into the patient. And then when you insert this, you just roll the bottle kind of to make sure all of the solution is administered. And that concludes enema administration.